Well, it's so nice to see you. So let me go ahead and just officially welcome everybody. And I'm not going to pull up my slides because Sharon's ready and we're going to just do it very quickly. But I'm Dr. Suzanne Smith-Rowley. I'm a founding partner of CLASI, the Collaborative for Leadership in Air Sensory Integration. Along with Dr. Zoe Mayu, I'm going to turn it over to her in a second to introduce Sharon, our colleague and beloved mentor. And so stay tuned. This is, I think, the fourth in this series of Theory Tuesdays, and we have a couple more coming up. And remember to stay for the raffle at the end of the webinar, and we'll do that. But I'll turn it over to Zoe, who can introduce Sharon now.
Thank you so much, Suzanne, and thank you, Sharon, so much for being with us and for navigating through that. Dr. Sharon Cermak is like an international treasure. I was going to say national treasure, but she's an international treasure.
Does that mean like an antique?
No. In fact, I was just thinking, you look like a teenager. You look so young. Whatever you're doing, you must have rid your life of stress because you look fantastic. Sharon, as Suzanne said, has been a mentor to both of us. She worked directly with Dr. Ayers and has contributed so much over so many years. We could go on and it would take the whole time. So you can read her bio, but she's really an expert in praxis. So we're just thrilled to have you sharing some information with us tonight about praxis and DCD, and I'll turn it over to you so we don't waste any more time.
Okay, well, I'm delighted to be here. I'm going to be talking today about sensory concerns in dyspraxia and DCD. And with sensory, I'm talking about both modulation and discrimination. There we go. So the purpose is to examine relationships between sensory modulation, sensory discrimination, praxis, and social issues in children with DCD and autism spectrum disorder. And this is collaborative research that I've been doing with Dr. Lisa Azizadeh, who's a neuroscientist in the Chan Division of Occupational Science and Occupational Therapy. So why am I interested in motor issues in autism and sensory issues and social issues in children with DCD? Well, the reason is that the diagnostic criteria for autism spectrum disorder is that children often will have sensory modulation problems. Then one of the new criteria is hyper-responsiveness to sensory stimuli. So that would be considered sensory modulation, but sensory discrimination is not part of the diagnostic package for children with autism spectrum disorder. Emotional are part of the diagnostic criteria, social emotional issues, but motor issues are not part of the diagnostic criteria for ASD. In comparison, for children with DCD, motor is part of the diagnostic criteria, but social, emotional, and sensory are not part of the diagnostic criteria. And yet when you talk to therapists and work with children, you see that many children with autism do in fact have motor coordination problems and motor disorders and praxis issues. And many children with DCD also have social issues. And it's less is known about some of their other issues. And also sensory discrimination, or the body senses, impairment in understanding information from our body senses, is a key component of dyspraxia. Ayers talked about it way back in 1965 in her early factor analytic studies, where she found a close relationship between tactile kinesthetic perception, body scheme, and dyspraxia. And actually that forms the basis of much of her theoretical framework about the causes or the underlying components of dyspraxia. We also know that parents and children who have either dyspraxia or DCD often report social problems. They're bullied by their peers, they don't have friends, they are left alone on the school playground. They don't play with other children. They're not invited to play with other children. They don't go to birthday parties. And oftentimes this is considered to be secondary. It's believed that their social problems are because they can't interact with them from a motor perspective. They don't have motor skills, and therefore they're excluded from games. But what if their social problems are also primary, like they are with children with autism? And then modulation has not been examined in DCD or dyspraxia very much. We've talked mostly about discrimination problems in DCD and modulation problems in autism, and how do all of these things fit together? So that's really what I'm going to be talking about today. And I'd love your clinical insights also as we talk. So again, I mentioned that this is research that's done collaboratively with Dr. Lisa Azizadeh's lab. There's increased recognition in the work that she's doing, as well as throughout the literature, that a high percentage of children with autism have motor problems. At first, they didn't consider motor problems with autism, but now it's considered to be highly prevalent. In the DSM, the Diagnostic and Statistical Manual, DCD can be co-diagnosed with autism spectrum disorders, where in the past in DSM-4, it could not be. And that really reflects the increased recognition that dyspraxia or DCD is comorbid with autism spectrum disorders. And in our neuroimaging research with children with high functioning autism with Lisa, we found that 80% of children with autism met the diagnostic criteria for developmental coordination disorder. It's a huge percentage. However, as I mentioned earlier, motor symptoms or motor problems are not part of the diagnostic criteria for autism. Maybe in DSM-6 it will be, but right now it isn't, except for repetitive movements. But new research is showing that atypical sensory and motor symptoms actually appear earlier than social communication problems in autism. And so they're thinking that maybe some of the motor issues and the sensory issues may be really important for the diagnosis of autism early on in life. So there are unique and overlapping motor, praxis, and social impairments in DCD and in ASD. And as I mentioned, DSM-5, the diagnostic criteria for DCD, includes impaired motor performance, but not social. And in contrast, ASD is characterized by impaired social communication and restrictive repetitive behaviors, but motor performance is not part of the diagnosis. So let's do a little bit on terminology so that we're all on the same page with the terminology. When we talk about sensory processing, and this I'm sure will be repetitive for most of you, but I'm just gonna, so that we're on the same page. Sensory processing is the ability to manage detection, modulation, interpretation, and organization of incoming sensory information. So sensory processing is like the big picture. And within sensory processing, we have discrimination and modulation, two aspects of sensory processing. Discrimination really refers to the ability to process sensory patterns and to interpret the quality of sensory input, especially the temporal and spatial characteristics of sensory input. So for example, if I give you a fork and a spoon with your eyes closed and ask you to tell me which is the fork and which is the spoon, you would not have any trouble doing it because your hands can feel the different temporal and spatial qualities of the information. If I gave you something like a nickel and a dime, most of you also would be able to do that because you have good sensory discrimination. Modulation, on the other hand, refers to the regulation and organization of the degree, intensity, and nature of the response to sensory stimuli through graded and adaptive responses. So it really is more of the affective component of sensory processing, the regulatory component. This is the model that is frequently used to describe sensory processing and sensory processing disorders. So we have the sensory processing disorders, and then within that we have sensory modulation disorders, which would be sensory over-responsivity, sensory under-responsivity, sensory craving, which is also referred to sometimes as sensory seeking. And then we have sensory discrimination on this side, which can be in any of the senses. And then when we talk about sensory processing, we're also talking about sensory-based motor disorders. So we're talking about dyspraxia and postural disorders. So just kind of as an overview with this, when we talk about an evaluation of sensory processing or sensory integration, if one uses something like the sensory profile or the sensory processing measure, that is tapping one component or maybe two components of sensory processing, but for the most part, they are not tapping this dyspraxia and postural disorders. And if we use something like the SIPT, the sensory integration and praxis tests, we are tapping dyspraxia and postural disorders. We are tapping discrimination for the most part, not all of them, but many of them. We're tapping visual, tactile, kinesthetic, some of the postural and movement. So we're tapping aspects of discrimination, but the test does not give us information about sensory modulation. That we need a different test for. So when we're looking at evaluating sensory processing disorders or sensory integration, we need to think about the big picture. So other terms that I want to get into, and many of you may already be thinking, what's the difference between dyspraxia and developmental coordination disorder? I tend to not stress about what the difference is. From my perspective, I say they are both difficulties with learning and performing motor tasks, motor activities, the ability to interact with one's environment. Where I do make a distinction is whether or not you are using a sensory integration perspective. So if you're using a sensory integration perspective, then when you're talking about dyspraxia, you want to be looking at the sensory base, the somatosensory base. You want to be looking at tactile, vestibular, kinesthetic, visual perception. You want to be looking at those perceptual abilities, which if you're just talking about DCD, you might not be looking at those. And in fact, most people don't look at those. So for terminology, dyspraxia is an impairment in the ability to conceive of, plan, sequence, and execute skilled or non-habitual motor tasks, particularly new and novel motor tasks. And that was what Ayres really emphasized. This is also one of the differences between dyspraxia in the child and apraxia in the adult, because in apraxia in the adult, that is frequently the result of brain damage, like a left hemisphere lesion. The individual has difficulty with skills that were already learned. They have difficulty with learning new skills, but they also have difficulty with learned skills. And for the child with dyspraxia, their primary difficulties are learning new skills, learning novel motor skills. So for example, if they learn how to handwrite using the Danielian method and then have to go to cursive, which is using a lot of the same motor patterns, but it's new, it will be a big challenge for children who have dyspraxia, who have impairment in this. And Ayres, when I say in a sensory integration perspective, Ayres found a close relationship between the somatosensory systems, tactile, kinesthetic base, that was associated with an impaired body scheme and praxis. And that was through numerous factor and cluster studies. Now, terminology for DCD. These are the diagnostic criteria. And as I go through each one, I want you to think about, would children with dyspraxia also have this problem? So from a sensory integration perspective, we're dealing with children who have dyspraxia with a somatosensory base. They have problems in body schema. Would they also have problems with this? Would they meet criteria for DCD? 1, acquisition and execution of motor skills is substantially below their chronological age and opportunity. They tend to be clumsy. They tend to have inaccurate motor performance and motor skills. Yes? Yes. I can't see everybody, but I saw Zoe shaking her head yes. The second criteria, it significantly interferes with activities of daily living. It impacts academic and school productivity, pre-vocational and vocational activities, leisure, and play. Does it do that for children with dyspraxia? Absolutely. There's a lot of literature. The onset is in the developmental period. Same true also for kids with dyspraxia. Yep, we see it in young kids. And it's not explained by intellectual disability, visual impairment, neurological conditions such as cerebral palsy, muscular dystrophy, degenerative disorders, Down syndrome. However, ASD or ADHD may be concurrent with DCD. So all of these, in my opinion, all of these criteria that are the diagnostic criteria for DCD would also be seen in children with dyspraxia. But what is added to this for children with dyspraxia is impairments in somatosensory processing, if we're talking about it from a sensory integration perspective. So is poor somatosensory processing unique to dyspraxia versus DCD? And I've already said it's not part of the diagnostic criteria for DCD. However, if you look at the older literature describing children with DCD, they talk about kinesthetic problems, and they talk about somatosensory tactile problems. And as in a recent study by Tran in 2022, they looked at sensory processing impairments in children with DCD in a systematic review. And they said that can't tell my notes. Sensory processing. Oh, they compared sensory processing in children with DCD to children who were typically developing, and they found impairments in all of these different areas of sensory processing in children with DCD: auditory, visual, vestibular, touch, proprioceptive, and multisensory. And they also found a relationship between sensory and motor in DCD. So those children who had more sensory processing impairments had greater motor problems. So it seems like there's some evidence to support impaired discrimination in children with DCD as well. And other studies have also shown that DCD is poorer than typically developing in somatosensory discrimination. There were a number of studies in looking at tactile kinesthetic. Ayers, one of the things about, thank you for that heart, I just saw a heart come floating up. Ayers, the population that Ayers looked at when she found these tactile kinesthetic problems was not a population of children with dyspraxia or a population of children with DCD. Her population was children with learning disabilities. And within that larger population, she found a very close relationship between dyspraxia and motor planning, postural praxis, and tactile kinesthetic impairment in multiple studies. But other studies have also shown, earlier studies have also shown kinesthetic problems and tactile problems in children who are specifically selected to have DCD. And one study that actually used the SC-SIT found lower scores in children with DCD in manual form perception, finger identification, graphesthesia, localization of tactile stimuli, kinesthesia, and double tactile stimulus perception. Sang found children with DCD had problems in haptic discrimination as early as 1995, when the term DCD started being used. Peak found that children with DCD had problems in kinesthetic sensitivity. In other words, they were problems with kinesthesia and proprioception. So what we're seeing is children, although sensory discrimination, tactile kinesthetic impairments that are so central to Ayer's theory of dyspraxia are not part of the diagnostic criteria for DCD, a lot of studies are showing that these children have problems. They're not so different from dyspraxia, which is why I say I don't make a big deal about differences. There also are fewer studies have looked at sensory modulation in children with DCD. Remember, I had said that more children with autism, or sensory modulation was really a key characteristic of children with autism, and it hasn't been looked at as much in DCD or dyspraxia. But Mikami in 2021 found that children with DCD, sensory processing was poorer in children with DCD than in typically developing children in oral sensory sensitivity. DCD had significantly more problems in registration, sensory sensitivity, and sensation avoiding. And in another study, Delgado and Lobetti looked at the short sensory profile too, and found that children with DCD were higher than typically developing children in low registration, sensory sensitivity, sensation avoiding, and seeking. So it looks like children with DCD are also having problems in modulation. We know that DCD is comorbid with a number of different things. It's comorbid with dyslexia, language disability, learning disability, attention deficit, dyspraxia, sensory processing disorder, autism spectrum disorder. Many of these things co-occur. DCD can be a standalone condition. Autism can be a standalone condition, but many of these neurodevelopmental disorders tend to co-occur. And for many of them, it's about 50% overlap, 30 to 50% overlap. And that's part of what brought us to looking at comparing ASD and dyspraxia or DCD. So the increased recognition that a high percentage of children with autism have motor problems. And we found in our research that 80% had dyspraxia, met criteria for DCD. But motor symptoms were not part of the diagnostic criteria. So when we look at comparing children, we know that children with dyspraxia have impairments in somatosensory discrimination, but children with autism, I mentioned before, have problems in modulation. Children with autism, whoops. Let's see, how do I go back? Nope. Oh, I see. Go back to. Okay. Children with autism have impairments in modulation, and children with autism have impairments in social. But it's so do children with DCD, but it's not part of the diagnostic criteria. So this basically is saying the same thing. And looking at overlaps, increasingly there's research that shows that individuals with DCD and those with ASD have overlapping impairments in social and motor skills, but very few studies have compared both of these in both populations together. This is a study that we did looking at motor skill in children with autism and children with developmental coordination disorder. And what we found is that both children with DCD and children with ASD, high functioning ASD, had poorer performance on the movement assessment battery for children. But they didn't differ from each other. So you can see these reds and purples are the children with DCD and ASD, and these blues are the typical children. There's very little overlap between the two groups, but both the ASD and the DCD show impairments in the movement ABC, which is the main test that's being used for diagnostic criteria for DCD. We also looked at the Florida Apraxia Battery modified for children, and that is another assessment for looking at apraxia or dyspraxia in children. And what we found is that on this assessment, children with DCD and ASD both had lower accuracy scores than typical children on all sections of the test. But there was one section of the test where ASD was worse than DCD, and that was imitation of meaningful gesture and gesture to verbal command. So if I were to say, show me how you brush your, pretend you're holding a toothbrush and show me how you brush your teeth. That's part of the area where children with with ASD performed lower. So if I was giving a verbal command and telling them how to do a meaningful gesture, they performed lower. But if the gesture wasn't meaningful, so if I said, like the AIRS postural praxis test, those gestures are not meaningful. They don't convey communicative value. There was no difference between the ASD and DCD. And that's on the SIPT postural praxis. Both groups were equally impaired compared to typically developing. So what is unique about what made these children with autism perform lower? Well, one of the things is that it's communication. So these gestures that were actually communicative in intent, they actually said something, showed something, show me how you cut with a pair of scissors, show me how you salute, all of those children with ASD had more difficulty with than children with DCD. When language was involved, children with ASD had more difficulty. Let me see if I can get these. And then this is some looking at children on the social responsivity scale, the SRS, which is looking at social issues in children with DCD and children with ASD. So the TD, the lower scores are better, and the higher scores indicate more problems, with typically scores scores above 60 indicating problems in that area. Which group does the worst? Autism, right? But do you see a significant number of DCD kids also showing scores above 60? Yes. So what we basically found is that children with who were typically developing had lower scores, which is lower is good, lower scores than children with DCD, who had lower scores than children with ASD. This social responsivity scale has really been used a lot to identify children who are at risk for autism. It's a measure of social responsivity. And yet what we're seeing is that children with DCD also are showing impairments on this, not to the same extent as children with autism, but more so than typical children. And then when we look at sensory modulation issues, we find that we've seen that sensory hyperreactivity and sensory hyporeactivity are now part of the diagnostic criteria for ASD and are seen in about 80% of children with ASD. But modulation has not been examined so much in children with dyspraxia. And using the sensor, which was the assessment that was developed by Lucy Miller and Sarah Schoen, the sensory overreactivity scale, children with autism showed more problems than children with DCD and typically developing. About 31% of the group of children with DCD showed significant problems in sensory overresponsivity. 74% of the group with ASD showed problems with sensory overresponsivity, and 4% of typically developing children showed that problem. So it's about a third of the children with DCD are showing sensory over responsivity. And with the short sensory profile, children tended to be looking specifically at the bystander. DCD was the same as ASD, and both were less than typically developing. So you're seeing some differences in sensory modulation between ASD, TD, and DCD. So what are the takeaway messages? And then we'll open it up for questions. The use of terms DCD, dyspraxia, and assessment varies as a function of discipline and country. I didn't really talk about that, but I will just mention that dyspraxia in the United States is used frequently within the sensory integration frame of reference, and it tends to refer to children who have difficulty with motor planning with somatosensory body impairments in body sense discrimination or body sense perception. The United States tends to not use the term DCD, Developmental Coordination Disorder, but DCD is used frequently in many, many other countries. And the reason it's used in many other countries started in 1994. There was a consensus meeting to look at terminology. At that point, the child with DCD was referred to as the clumsy child. And people thought that that was pejorative. And so about 80 people got together in a meeting. There were a few OTs and PTs, and there were pediatric neurologists, psychologists, everyone interested in this clinical population. And the idea, the purpose of this 3-day meeting was really to come up with another term, not the clumsy child, but something that was less pejorative. People at the end of 3 days could really not come up with anything that everyone agreed on, or that they really felt clearly told the story about these children. And so they decided to use the term developmental coordination disorder because it was already in the DSM and it was already a diagnostic term. What they decided was that in all research, so that everybody could be on the same page in research, all research should always incorporate the terms DCD, developmental coordination disorder, when you were talking about this population of clumsy children. They didn't necessarily say DCD was the only term that should be used, but some people have decided amongst that DCD is the term that should be used. Within the disciplines, even within occupational therapy, Canada uses the terms DCD. We tend to use in the United States the term dyspraxia. England uses the term dyspraxia, but some other countries use the term, a lot of Europe uses the term DCD. And so we need to be aware of which country, which discipline, and what we're dealing with. There has been a study that was recently published called The Impact for DCD. It was a study published out of Australia, and it included something like 400 parents of children with DCD who completed questionnaires on what is the impact of DCD on your child. And what it showed really was that DCD had significant impact in multiple areas of performance. And so again, it's really consistent with what we've been talking about, is the far-reaching impact of dyspraxia or DCD. Another takeaway message is that DCD and ASD both have problems in motor skills, both have problems on the postural praxis tests of the SIPT. Thus, we need to look at motor and praxis in both groups when we're doing an assessment. ASD had fewer problems than DCD on parts of the Florida Apraxia Battery that dealt with communicative gestures. And that makes sense because children with ASD have particular problems in social communication. But about 35% of children with DCD showed social problems, and about 30% showed problems in sensory modulation. So it's important to consider all of these areas when we're assessing DCD and ASD. And those are the primary takeaway messages that I think I have. So maybe we can open it up to some questions.
That's so great, Sharon. Such a lot of information. Thank you so much for sharing your research. I actually pulled a couple of books. Do you remember 1985? You have a chapter in
Oh, yeah.
Roy. Yeah, I mean, and so and then the Ares Dyspraxia monograph. If anybody, she wrote the opening. Well, it was a foreword, but it was a full chapter with 2,000 references, you know, from 2011. So I actually, if I can indulge myself in a question, I was wondering, because you've been working on this for publishing on dyspraxia for over 40 years. Do you see the nature of dyspraxia changing, or like in clients, or the view of dyspraxia changing over these many decades?
There is way more research now on children with DCD dyspraxia than there was 40 years ago. Most of it is not being done by occupational therapists, unfortunately. A lot of it is being done, well, some of it is being done by occupational therapists, but it's also being done a lot by physical therapists, by psychologists, by movement specialists. And in a way, that's great because. One minute. Oops. Sorry, I have two cell phones here because of the computer problems, and I wasn't sure which one I was turning off. I didn't want to lose you guys. So I think that we have way more research now than we used to. A lot of the neuroimaging studies that are just beginning. In 1984, Goubet, who was a pediatric neurologist and one of the sort of fathers of clumsy children and DCD, talked a lot about some of the problems that children had. And I think a lot of what we're seeing now are, what I was going to say is in 1984, he said there were no neurological impairments or no neuro problems in children with DCD or dyspraxia. And with our newer sophisticated imaging, we actually can say, yes, there are problems now in children who have dyspraxia or DCD. We can say that there are known connectivity problems, connections between parts of the brain. There are areas that are not functioning as well. So we've really learned a lot more about functional connectivity and how the brain is working in children with DCD, what aspects of the brain may be impaired, and the relationship between, for example, the motor areas and the affective areas like the amygdala and the insula and their contributions. It's not just the motor system. So we've really learned a tremendous amount more, and there's been a lot more research with children with dyspraxia or DCD.
Yeah, and in a recent search I just did, the amount of research on these kind of concerns in autism is just profound. So it seems like there's much more of an acknowledgement now and a deeper dive into those concerns that used to be sort of more about imitation and gestural communication, but now really the whole gamut of the kinds of things we examine. And, you know, and the very high prevalence in autism, but also in other populations as well. Mm-hmm. But I'll stop and I'll give somebody else a turn. Anybody else?
I know we have some questions from the group, so maybe Marco, do you want to pick a couple to
Pick
share?
the easy ones, Marco.
I think you're on mute, Marco.
Thank you for that. So we have this question about a potential overlap between ADHD and DCD, and if adaptation issues exacerbate sensory integration difficulties. Do you want to take this one, Sharon?
Can you say it again?
So it's really about the overlap between ADHD and DCD.
ADHD and DCD. I would say just like where I talked about autism and DCD, you'll find the same overlap between ADHD and DCD. Some children can have one without the other, but for many children, they are comorbid. And it's not the lack of attention that causes the motor problems in many of the children with ADHD. They genuinely have impairments in motor planning and praxis as well.
Thank you. There's also a question that came from the chat from Patty. She's asking if you feel that the reflex of fight, flight, and freeze contributes to dyspraxia in somehow.
I think it contributes more to modulation than to praxis, but we've just talked about the fact that about 30% of children with dyspraxia or DCD also have impairments in modulation. So it probably is very appropriate for a subsample of children with dyspraxia as well.
Thank
Sure.
you.
Can I ask you to comment on ideational praxis and how that might relate? You know, we have a new test on the EZ of praxis ideation, and we can't wait to see some of the analyses, but I'm just curious if you have anything to share about your thoughts on ideational praxis.
Let's go back. I want to get it into the definition of. Okay, the definition of sensory processing. Oops, where'd you go? Come back here. Is the ability to manage detection, modulation, interpretation, and organization of incoming stimuli. And when we talk about detection and modulation, with this, we're not really talking about ideation so much as about using our senses, but how do we decide what to do? And that's what Ayers talked about, is ideation is knowing what to do, and praxis is more knowing how to do it. So how do we know what to do? I think it's a really important component, because you do see some children, we see them all the time in our clinics, and they come in and they just stand there and you say, go play. And the typical child will immediately start going into the activities. And I mean, some kids are like really shy and they'll hang behind their mother, but then they'll start moving and they'll start doing things. Other kids will just stand there and do nothing. And those are the children who really have difficulty knowing what to do, or children who may do the same thing again and again and again and again. Lining up toys is sort of characteristic of that. I think those are examples of children who have difficulty with ideation. They just do the same thing. It's not a toddler, because it is part of normal toddlers' behavior to do those things again and again. That doesn't mean they have autism, but when it's continuing beyond the age that you would expect it to continue, it may be an example of an ideation problem. It may reflect an ideation problem of knowing what to do, knowing how to use objects. How is it tested in the EASY? Can you talk about that, Zoe?
Sure, we have 4 items and we ask the child to show us everything they can think of to do, to demonstrate, show us everything they can do with their hands, with the chair, with several objects, and with their body. So it's not only what you can do, like what's possible to do. And I'm so curious how strong of a relationship we may see with tactile and proprioception, tactile perception and proprioception, because watching little ones who spend so much time in exploration with that kind of repetition over and over again, mastering the information they get through touch and position sense, which informs all the things you can do with objects with your body. So
I'm wondering, as you're speaking about how technology is going to influence that, when we, instead of having children interacting with objects and stacking and moving them differently, everything is on like a little cell phone screen or a little iPad screen, and the children aren't actually handling the objects. They're handling fake
Right.
objects, but there's no
Yes.
weight. There's no weight to them. There's no consequence.
Yes, one of our colleagues in Portugal, Paulo Fernandes, is looking at screen time, and I think he's using these tests on the EASY. So we may be able to see if there's some correlation with excessive screen time.
Yeah,
That's
I'm
been
all
a
for
hot
screen
topic.
time. I'm all for screen time. I think it has tremendous benefits, but I think it needs to be balanced with lifetime.
Yeah. Okay, well, I see we're at time already. How does this happen every time?
Well,
I
let
will
me-
mention, and I don't have I can't access the information because of the computer problems that we're having, but I have 2 ongoing research studies that I would love to have people participate. Both are for Yvonne, your phone. Both are for therapists in the United States, though I am interested in looking at expanding it into other countries. The first study is the impact for DCD study that I would like to have. I would love to have. We're looking at the impact of a child having developmental coordination disorder in 5 areas of development. And parents would complete a questionnaire. So I'm looking for therapists working with children with DCD who would be willing to give parents access to, or give parents information about the questionnaire. It's done online. And the other is I'm interested in looking at teacher training, beliefs and practices regarding handwriting, because what we're seeing is an increasing decrease in the amount of time that is spent teaching handwriting, and an increased number of problems in children with handwriting problems. So I'm looking for teachers in the United States, and this is a study that I think I'd love to extend beyond the United States. Looking for teachers of kindergarten through 3rd grade, typical teachers, and what they are doing regarding teaching handwriting. If anyone can help, if you just send me an email, I hope I get swamped, to sharon.cermak@gmail.com.
We can put a link
Yeah.
with the when
Okay,
we post
great.
this,
That's
Sharon.
awesome. And I'll also,
Elizabeth just shared the link, but we can send it by email for all participants. Sharon.
okay, I'll also send you a list of references of the references that I talked about, and if you want to add that link as well, and the
That would
PowerPoint
be
if you
great.
want.
Yeah, people
Thank
will be very grateful if you can add the PowerPoint and the references. Thank you so much.
Okay, sure.
Suzanne, we have some winners to share.
Oh,
Well, can I just give my concluding slides? Oh, but now it's not up. Okay, just a
Can you do
second.
it?
Okay, here we are. Let me share. Okay, let me share. Here we go. Okay. So
thank you,
I just have,
Daniela.
Okay, so here we are. We have a couple more webinars left, so just look at the website and you'll see we have one coming up October 24th and November 21st. So come and join us on those two webinars. Many of us are going down to Rio de Janeiro for the International Congress on SI, and the board wanted me to let you know that it is going to be available online. And so there's very interesting topics and speakers. So hopefully you can join in person, and if not, you can sign up for the online version. And we have the CLASI program that teaches air sensory integration from start to finish. And so Marco, I'm going to turn it over to you for the raffle. That's it for me.
Thank you so much. So we have two winners like we usually do in this webinar. I'm going to start for the Easy Starter Kit. The winner is Sandra Tamay or Tamai. I'm sorry, Sandra. Congratulations. You just got a new Easy Starter Kit. Thank you for being here with us. And the Southpaw winner, Southpaw is giving a voucher, a piece of equipment. And the winner for this time is Ana Navarro Teruel. So congratulations to you both. And thank you so much to CLASI and Southpaw for this.
Sharon, thank you. That was just a fantastic presentation. And thank you, as usual, Suzanne, for your amazing skills in putting together these webinars, and our CLASI team. Thank you, Marco, and to everyone. We hope
Thank you, everyone, for getting me online.
Well,
was worth the wait.
It was worth the wait. And and hopefully we'll see everybody at the next webinar. Stay safe, and we will see you next time. Okay, thank you, everybody.
Thank you.
Thank
We'll
you.
be in touch,
Thanks.
Sharon.
Okay, great.
Okay,
Bye.
bye.
Thank you so
Bye
much,
bye.
Sharon.
Bye. Bye, Melissa.
Bye.
Bye. See you soon.